Hello and welcome to my channel Empowering Aesthetic Excellence. And the maximum number of patients that we see walking in for aesthetic clinics have concerns related to the eyes and the periorbital region. So, which is why I'm doing the series of eyes and the periorbital rejuvenation. This is the fourth video in the series, and in this video, I am going to be discussing a few things about the eyebrow rejuvenation with respect to brow lift. There are multiple variants of eyebrow rejuvenation for brow lift. And so every variant will be discussed in a separate video. And so that it's not confusing and it's easier for you to understand. So let's get started. So when we talk about eyebrow rejuvenation, brow lift, it mostly refers to the lateral brow rejuvenation or lateral brow lift. And there are multiple variants. As I discussed, there are multiple variants for it. So the first variant is isolated Botox brow lift. That means there is a person coming to you and they just want a slight brow lift. And that's it, nothing else. The second variant is there is an individual, they have certain signs of aging of the in the periorbital region, like some forehead lines, some glabellar lines, some crow's feet, and they want to treat them along with some brow lift. So that is the second variant. The third variant is that you have to give, or dermal fillers would give a best result in some individuals. We will be discussing this in detail when we come to that video. And the fourth variant is the brow lift with threads. So in this video, we are discussing about the first variant, which is just the isolated Botox brow lift without any other periorbital manipulation with Botox. So as with any other procedures, the best way to give results or the strategy to give the best results is identifying the right individual for your treatment. So to identify the right individual for the isolated Botox brow lift, there are certain parameters that you need to assess. Now, the various parameters that will help you assess the right individual is, number one, you will see the skin elasticity in the eyebrow region and the skin laxity. So someone coming only for Botox brow lift should have good skin elasticity and no skin laxity, then only it will give the best results. There should be no upper eyelid hooding. That means there are no signs of sagging. Fourth thing, there has to be no hyperkinesia. The theory of hyperkinesia, as I have explained in the previous videos. So there should not be there. That means, again, it is a sign of aging. Another very important factor is that whether or not microblading or eyebrow tattooing for thin eyebrows or sparse eyebrows or light eyebrows was done before in previous years or at a younger age. And if at all it was done, was the natural curve of the eyebrow given, or they created an exaggerated arch with the eyebrow tattoo? That means some individuals who have very light eyebrows, they get eyebrow tattooing done in a way that the tattoo is given the shape of an arch to create or to give the illusion of a raised or arched eyebrow. So if somebody has already gotten microblading done during their previous years, with the shape or with the arched shape, their natural shape is flat, but they got microblading done in a way that it looks arched now. So in these individuals, if you further lift the brow, it is going to give a very spocky look. So these are again not very good candidates for just the isolated Botox brow lift. And the sixth thing that you have to see is that there should be no temple hollowness. So if there is some degree of temple hollowness, then again, they are not ideal. It's not that you cannot do a brow lift in these individuals, but there are some do's and don'ts, and there's few things to already tell the individuals that this is not going to give a complete result. The results might be a little compromised. So if temple hollowness is there. And again, seventh thing is that the presence of horizontal forehead lines, they should not be present. For isolated Botox brow lift, all these things should not be present. Only skin laxity should be good. So as I mentioned, this is the first variant, isolated Botox brow lift. And in this, we lift the tail end of the eyebrow using Botox. So this technique, it will involve injecting the Botox strategically into specific muscle. And this results in slight lift of the eyebrows. And this can also be used to treat one eyebrow, again with discretion, to correct little minor asymmetry. Again, I mentioned this has to be done, if at all it is attempted, it should be attempted with slight discretion. So this technique will create a very youthful and refreshed appearance. And this can be used in isolation, as we are discussing it in this video, or we can combine it with other modalities also to create some bespoke results for the patients. So as I mentioned, the prerequisites, no forehead wrinkles, no temple hollowing, no crow's feet, no loss of, no compromise of skin elasticity, and no upper eyelid hooding. So this means that these individuals are usually young individuals who have genetically low arch brow. That means they always had flat eyebrows. They never had that arch to the eyebrows. So that is, these will be women above the age of 25, and between 25 to 35, or maybe 20 to 35. So because before that, during when you're a teenager, the eyebrows are as it is flat and bushy. The arched brows, they represent femininity and maturity, and which is why individuals are above, that I mentioned, are women mostly, and above the age of 20 to 35, that age slot. So when we anatomically break down the low arched or genetically low arched or flat brows, so we have the lateral fibers of the frontalis. So here we are just talking about the lateral brow lift, or the lift of the tail end of the eyebrow. So frontalis, the lateral eyebrows of the frontalis is the only muscle, only fibers which are elevating the brow. And the lateral brow depressors are orbicularis oculi, lateral fibers of orbicularis oculi muscles. So these fibers, the lateral fibers of frontalis and lateral fibers of orbicularis oculi, are in perfect balance of each other and keeping the eyebrow in position. So how do we do isolated Botox brow lift? What is the mechanism to lift the tail end? So we know that the orbicularis oculi muscle is responsible for crow's feet wrinkles around the eyes, and they pull the outer eyebrow or the lateral eyebrow downwards and inwards. So when you inject Botox into this lateral part of the orbicularis oculi muscle, the counteracting action of the frontalis becomes little exaggerated, and this brings about the brow lift. So that means you weaken the lateral brow depressors, which removes the counteracting effect to the elevators, and this brings about the lateral brow lift. So how do you mark for the isolated Botox brow lift? So there are 2 points ideally. So as we mentioned, it is in the lateral fibers of the orbicularis oculi beneath the eyebrow. So one point is in the tail end of the eyebrow, and the other end is at the junction of the medial 2/3 and lateral 1/3 of the eyebrow. So these are the 2 points where you inject beneath the eyebrow very superficially to give the brow lift, 2 to 3 units at each point. So you inject Botox into first point is the tail of the eyebrow, and second point is junction of medial 2/3 and lateral 1/3 of the eyebrow. So this isolated Botox brow lift, it can give a lift of around 2 to 4 millimeters, and the results can last from up to 3 months or maybe 6 months, depending upon your choice of neurotoxins. And usually, this variant is highly appreciated by female models and brides because in models, it gives a more feminine and more, powerful look. And when it comes to brides, it is giving more of a photogenic look. The eyes look more open, wide open eyes. So that gives a very nice photogenic look to the eyebrows. So this was about the isolated Botox brow lift. And I hope you understood this. Do share your comments, do share your suggestions or questions if you have any in the comments below. And if you have any concern, or if there is something that you did not understand, you can get connected to me on the WhatsApp number given below in the comments. So I hope this video helped, and Keep watching and keep sharing your knowledge. And see you in the next video. In the next video, I'm going to be discussing about the second variant in which there are signs of aging along with brow lift is desired. So bye till then, and hope to see you soon in the next video.